Hello everyone, just figured I'd post a quick video before the election. That way I can get my opinion out there and no one can say I didn't try. So as you all know, the current state of affairs in America is focused on healthcare and how it needs to be accessible to the people of the United States. This discussion has been ongoing for nearly 100 years. The debate stems from the idea of whether healthcare is a right or a privilege. Both sides of the debate have legitimate arguments with convincing principles. Realistically, I have to argue in favor of healthcare being a privilege. Before delving into the guts of the argument, I think it is important to refresh everyone's memory of the history of healthcare to make certain that we are all on the same page as to where it came from and why it was created. The healthcare system has been redesigned numerous times throughout history. The origin of Social Security goes back to the 1930s, when it was designed to assist those who were no longer capable of working efficiently in society, particularly due to physical disability or poor health. In the 1940s, President Truman's efforts to further the governmental funding reforms failed due to a lack of available healthcare resources. America was experiencing a push for independent insurance, encouraging wellness visits, and expanding healthcare services. The challenge was that the medical community was not staffed or prepared to handle the increase of patients. In the 1950s, the price of healthcare began to increase. Private insurance companies boomed, with an influx of policy buyers. By the 1960s, over 700 companies were selling health insurance to America's population. This started to affect the care delivered to the Social Security fund of patients, as the insurance companies were able to pay higher prices, which made insuring patients more desirable to the medical community. In 1965, another rush of governmental involvement rose up with a prepaid group healthcare plan called Medicare and then one called Medicaid. This success was short because the plan used federal funding and was cut short by the slowing economy of the 1970s and the rising distrust of the government. In 1990, President Clinton reintroduced the idea of healthcare reform and proposed the concept of allowing insurance companies to lead the movement. The managed care movement brought forth by the insurance companies overshadowed any political action President Clinton tried to further. Following this rise in private health care, the government expanded education and healthcare professions to increase the amount of doctors. Since the 1970s, healthcare has moved on a steady path. This progression showed a relationship between medical knowledge becoming more advanced, an increase in healthcare prices, and a decline in those able to afford healthcare. In 2008, presidential candidate Barack Obama spoke of change coming to the current healthcare in America. On March 21, 2010, over a year after Obama took office, the change promised by Barack came into effect. The healthcare reform bill was passed by the Democratic Congress with a vote of 219 to 212. This bill has shifted the healthcare policy in a completely different direction. Prior to the bill being passed in mid-March, healthcare was considered a privilege for those who could afford it, and a commodity to those who sold it. Healthcare will now be available to all via the government. This reform attempts to define healthcare as a human right. In the previous attempts at national healthcare reform, there have been improvements made from one to the next. When looking at the improvements in previous years, there have been two major dilemmas that continue to fail each time. The first involves a failure of policing, procedure, and the second is funding. Fraud has been an issue since the inception of federally funded programs, and presumably would be an issue with regards to healthcare. An example of past misuse of federal aid is the use of food stamps to purchase small quantities of food in order to receive the change back. Then, there are the disability claims and Social Security claims of people pretending to be unable to work, yet having no problem with doing side work off the books. If healthcare stays socialized, thieves and abusers of healthcare become the burden of the entire nation. Again, this is not fair to those not abusing the system. With socialized medicine, how and with whom will there be an accountability? To maintain the healthcare reform, when there has been gross neglect with both Social Security program and Medicare and Medicaid programs, though there are legitimate recipients of these benefits, there are millions who collect this federally funded aid after they have recovered. The misuse of this aid results in fraud by both healthcare providers and the recipients of the benefits. The current process of self-disclosure and using whistleblowers will not be sufficient. Funding is the second most prevalent issue. When it comes to the discussion of right versus privilege, President Barack Obama plans on having the healthcare bill paid for by the taxation of the American population. Starting in 2012, the Medicare payroll tax has expanded to 2.9% and includes unearned income. By the end of 2013, it will be a 3.8% tax on investment income for families making more than $250,000 per year. Beginning in 2018, insurance companies will pay a 40% excise tax on so-called Cadillac high-end insurance plans worth over $27,500 for families. Those families who make $250,000 are less than 4% of America's current population. So in short, the plan is to force 3.17% of our population to pay 15.3% of our population's health care. How can that possibly be fair? Also, if you look at the logistics of making healthcare the complete burden of the federal government, there's a concern for its ability to sustain healthcare. As it is, healthcare is in a high demand, and currently there is a significantly increasing ability to pay. If privatized sectors cannot handle this, how can we expect the government to handle it without any competition? It is now speculated that Americans will be paying one in four tax dollars to healthcare system. This type of spending will only detract from other areas of concern within our society, such as our defense, security programs, our infrastructure, and our educational systems. American tax money needs to stay focused on those programs, because truly they sustain our nation in the long run. Now, beyond just the plan for funding and potential policing issues, there are the more evident reasons why this nation needs to defer from making healthcare a right. There's a technical definition of what a right is, and how healthcare realistically should not be forced to adhere to that definition. Then there are actual examples of healthcare as a right failing in other countries. The argument of privilege versus right revolves around human rights and the idea that healthcare should be provided to all as a right. The discussion that healthcare is a necessary right infers that it takes place next to the other basic needs, such as housing or food. But a right is defined by Merriam-Webster.com as something to which one has a just claim. Consider, there are nearly 700,000 homeless people in America. Yet having a place to call home is not considered a right, but receiving healthcare should be. There are people who go to bed hungry at night because they cannot afford food. Food is not a right, yet receiving healthcare should be. Nowhere in the Constitution does the government promise its people healthcare. In our nation's Declaration of Independence, our rights are listed as life, liberty, and the pursuit of happiness. These listed rights demonstrate the right to act. Not ever is there a statement or inference made regarding the right to things. Healthcare along with food and housing are things. Aren't these things necessary for the pursuit of happiness? Yes, but they are not guaranteed. The government within our country was founded on the idea of guaranteeing its people was not founded on the idea of providing our people with physical things, but only the right to obtain those privileges. The United States can examine Canada as a reference. The Canadian government has had a form of nationally funded and directed medicine since 1966. But it was not until 1984 that they developed a system similar to what was just passed in the United States. In Canada, healthcare is viewed as a right. All hospital visits are paid for, and insurance covers just about anyone for just about anything. As good as this may sound, there is a significant issue rising up in Canada. With a nation of socialized medicine, everyone receives care, and what has happened is that there are tremendous wait times for those people who need specific or specialized procedures. The average wait time for a patient in a Canadian hospital is 18 weeks. That's from seeing a doctor to undergoing the treatment needed. In response to these circumstances, private clinics are becoming more popular. So let's get this straight. Canada's had nationalized healthcare for years, yet the citizens are turning to privatized clinics when they need a doctor's help. In fact, these privatized clinics are popping up at a rate of about one per week. These clinics cost more, have a smaller staff, and yet treat in far less time. This is what a privileged system of healthcare is like. So Canada stands as evidence that healthcare, as a right, has a high incidence of delayed effectiveness, which would translate even worse in America, especially when you take into account the higher rate of hospitalization in America. Just to bring this back to the issue of funding, well, Canada is currently spending 10% of its gross domestic product on healthcare, and that does not include what people are paying out of pocket at the privatized sector clinics. That's something to think about. If this isn't enough to persuade you, then maybe you need to hear a story about how privatized insurance impacted my life. To start, you need the background. I'm dating a young lady whose parents pay for private insurance. Their insurance plan allows them to see any doctor of choice, and it covers just about everything. This is important because about a year ago, that young lady, my girlfriend, was diagnosed with lymphoma. Luckily, she was able to visit a doctor and is currently being treated at little cost to them. But beyond that, her family is happy to have privatized insurance that is protecting them from 18-week wait times like in Canada. I'm happy that she does not have to wait to be helped. I can't even imagine what it would feel like to have to deal with such a severe situation in a country that is not set up to be conducive with her being treated and saved. I fear for those who have to endure such hardships in nations with socialized medicine. Luckily, my girlfriend was covered under privatized insurance, but not everyone is, as privileged as I know. So if healthcare is to avoid becoming a right as per the federal government, it needs to be managed more carefully. It has to have some important improvements to make it more available to the entire nation. If healthcare is to be a privilege, then healthcare maintenance and accountability need to be the primary objectives to secure its success and to discourage fraud. Some suggestions from someone working in the medical field, Director Clyde Smith from Beaver Dam Community Hospital, would be such things as having acute disease treatments being monitored for causative agents and chronic diseases being measured by personal lifestyle and genetics. It has been suggested that offering incentives for improved lifestyles and healthy living may be beneficial for creating support. These objectives have to be easily accessible and tangible to all of America. If the healthcare recipient fails to meet these objectives, and choices are made that aren't supportive of living healthy, there needs to be a process of consequences. A hypothetical example that I can think of, which I'm sure has occurred before, is a patient who is diagnosed with as a type 2 diabetic and is noted to be 50 pounds overweight. The tangible objectives set forth by this person's healthcare provider could be a required weight loss of X number of pounds in X weeks and an enrollment in dietary counseling. If this person does not lose the required weight and enroll in dietary counseling by the specific date, his or her assistance could be decreased or eliminated. This helps to define what makes up the accountability factor in order to fulfill all the requirements of being a privilege by definition. If the individual does not meet the requirements, the insurance company will give up or change the coverage. By focusing on the policing and maintenance of healthcare system under the idea of it as a privilege, you will naturally lower premiums, and therefore you make it more available to the masses. Now, it is undeniable that these facts present a compelling argument. Healthcare should not be viewed as a right, but as a privilege that should be modified based on personal accountability. Food and shelter are not considered rights, but they are needed for life. Healthcare is on the same plateau. Healthcare should be held safely by those that subscribe, something that should not be misused or manipulated, like other government programs can and have been. Healthcare in the ideal world would be both a right and a privilege. It could be a valuable entitlement for everyone, but as America waits for the newest information, healthcare reform, and the direct results of it, disagreements continue. Until there's a general consensus among the American citizens as to why all should or should not have healthcare, and we establish formats of policing and funding across the nation, America will never come to an agreement as to how the infamous healthcare reform should be handled. But I hope that before you vote, you consider the facts you've been provided. Obamacare is not sustainable in the long run. It is not fair to our population. It is purely illogical and downright terrifying. Take everything I've said with you when you go to the polls today and in the future. Hopefully you vote for the government that can discern between rights and privileges, and thusly you can preserve the American way of life.